Hey guys, it's Dr. Philip Oob here in Austin, Texas. I've got Dr. Joshi with me online. He doesn't have video at this time, but he's over there in Europe. And where exactly are you, Dr. Joshi?
I'm in London.
Okay, in
Oh,
London. And so we're going to talk about pulmonary fibrosis. He knows a lot more than me at this point. It was a question that was raised to me yesterday, and I didn't quite know the answer. So him and I have been talking and putting some stuff together. So first, Dr. Joshi, we want to know what's going on in London.
well, we're preparing for a lockdown, and what they're trying to do is to contain the viral spread within the United Kingdom. Our Prime Minister has encouraged everybody to stay at home, to do self-isolation, and that way to try to contain the virus and to stop its spread.
And so what's it look like out there? Is it pretty desolate? Are people actually isolating?
It's a little bit like being in one of these Armageddon movies. You go around, and I've never known everything to be shut. Absolutely everything. There's no restaurants open, no bars, no clubs, no coffee shops, nothing. You can't sit anywhere. You cannot eat in a hotel unless you're a guest. Gyms, schools, everything is closed. Shops, everything is closed.
It's wild. It really is like a movie. So, do you know anything about the hospital system out there? Because here in America, at least I'm out of touch of what's going on in Europe. Other than Italy, they're dominating the news.
Um, Ultimately, if we look at the way that they're trying to control the spread of this virus, they the only thing that they can do is to try and stop people spreading it. And so that's one of the reasons why they've tried to contain it since it entered our shores as much as possible, because otherwise people will go through the incubation period and so many multiples of people are getting infected. It would end up completely swamping and perhaps even collapsing the whole medical system.
Yeah, it's spooky.
Yeah, because I think ultimately a lot of people don't fully understand um, what we're dealing with. It's a completely new, unknown virus. It's way stronger than anything we've had before. And the extraordinary thing about this is that you can be infected with it, but yet be completely asymptomatic, but then infect everybody else. So
And that's why it's spreading.
whereas if you had flu, you wake up in the morning and you feel like you've been hit by a truck. Whereas with
Right.
this, you feel absolutely fine. And so you go through this incubation period where you don't know you've got it, and you have unfortunately infected countless other people who are doing the same thing. And then the incubation period happens, but there is we call it an incubation period, but in my mind, it's a sort of while the virus is actually already causing damage to the body, and then you become acutely asymptomatic.
Do you know anybody that's got it? Do you or your staff, anybody that's had symptoms yet?
Nobody that we know so far that has symptoms. Actually, one patient called up and he was complaining of fevers and a little bit of a cough and a bit of a sore throat. And we suggested for him to stay at home. His partner is self-isolating herself with him as well. She's completely fine. And he's already improved in the last 10 days.
Okay, good. Oh, wow.
Yeah.
So it was 10 days ago.
Yeah.
Yeah, I guess you guys got a head start on us. Here in America, I just spoke to my parents in Louisiana, and they're saying that some of the people in Louisiana are not taking this serious. They are having crawfish boils and getting together, and there's parties going on. Everybody's off work, so let's have a party. Some of the bars are full of cars in the parking lot. Well, I don't know if those bars, but something was full of cars as they were passing by just to get gas and go back home. So it could turn much worse for America. It sounds like the UK is taking it very seriously.
Well, even in England, I felt as well that a lot of people were not taking it seriously. They were still trying to meet each other at coffee shops. They were still trying to sort of meet each other in parks. The gyms and everything. The Prime Minister thankfully took the decision and basically shut everything down and has tried incredibly hard to encourage people to stay at home, to not spread it, and try to keep themselves to themselves. And in fact, this afternoon, I heard this interview on LBC radio, and they were interviewing a doctor who is in ICU working in one of the major hospitals. And he himself said that all the government wants you to do, and they're actually willing to subsidize your loss of earnings as well,
Oh,
is to
wow.
sit at home, be a couch potato, watch Netflix, and just don't go out anywhere.
Right.
You know, we've had a
Oh,
mad
Netflix
rush
is
to
booming
find
right now.
groceries. Sorry.
I said Netflix is booming right now.
Yeah, absolutely. You know, but you know, like people have had like a mad rush for groceries, and you know, it's sort of, they're all in a bit of a panic. But to be, to be honest, in my particular practice, a lot of my patients, kids broke up last week, and they've got 4.5 months holiday, and a lot of my patients basically just fled to their, holiday homes and have disappeared to
Oh,
warmer
I guess that's
climates
good.
where hopefully there is no virus.
Okay. Are you hearing of young people getting sick? And by young, right now, everyone's saying that, oh, if you're under 50, you're fine. I don't agree. But are you hearing of young people getting sick? Because we are here in America.
I mean, I don't think that young people are immune to this virus, but they cope better with it. This is the problem, or this is the good thing, rather. You know, what we're very acutely aware of is that the older generation, over 70, people with heart conditions, pulmonary conditions, who are obese, who are unfit, unfortunately, are going to have a more rough time of it. And they are, much more in danger. Whereas if you are young, it doesn't mean you don't get it. There are people who've got the virus and actually are asymptomatic, but it just means that you're more able to cope with it.
Right. Right. So one of the main reasons for us talking, in addition to just kind of seeing what's going on in Europe and hearing maybe you guys are ahead of the curve and can help us, hopefully not ahead of the curve, meaning getting sick, but I think you guys are further along than us. But so this whole pulmonary fibrosis thing caught me completely off guard when we did a Q&A. I think I did yesterday, but that was Thursday, feels like yesterday, so several days ago,
Yeah.
of this pulmonary fibrosis finding. And I haven't seen any articles on it or research proven, but I'm hearing after I got that question, I asked you, I asked a couple physicians, and they are saying they're seeing it. So you've done a little bit more research dive. And so I want to talk about pulmonary fibrosis. But first, I'm going to start from the ground up because this video is mostly for the lay people, not other physicians, although I'm sure they will be watching it too. But first of all, what is pulmonary fibrosis from your standpoint, the basis of it?
The base, very simply, the lung gets scarred. You create an inflammatory condition, and that creates scarring within the lung, and the lung function is compromised.
Okay. And when does this usually develop? How does pulmonary, what is the usual time you see pulmonary fibrosis?
In my understanding is that pulmonary fibrosis is usually a sort of long-term, gradual onset, in smokers, asthmatics, or people who get regular chest infections. People who are regularly causing inflammation or infection within their lung tissues will eventually end up with a little bit of scarring, which is going to affect the lung function.
Right. And so what type of patient should worry right now? Same thing, not just, so previously pulmonary fibrosis. I mean, the only patient I can think of was an autoimmune patient that I had that
Yes.
had pulmonary fibrosis.
Yeah.
So so is this, anyone should worry about this pulmonary fibrosis, or does it seem to only be picking certain people?
No, this is the thing that, from my understanding with this virus, it is attacking the lung tissue, and it's actually creating fibrosis. And that is when you end up with respiratory failure and death.
Okay, so the big concern right now is when to go to the hospital. So what are the early signs that people can start to see if they are developing that pulmonary fibrosis?
We are in an incubation period at the moment. I mean, there have been a lot of identified cases, and they're being treated in hospitals as well. The government has urged all the population to stay at home. They're going to wait for a certain period of time, the incubation period, if you like, where people will see if symptoms are developing. Unfortunately, a lot of people, are very worried about it, of course, and they don't know how to react, and they don't know what they should be expecting, and they don't know whether, what they're feeling at the moment is an allergy, or whether it's flu, or whether it's COVID-19. And
Right.
ultimately, one of the things that urged me today actually to do a little post on my Instagram was a lot of patients were wondering, how do I know that I don't have it? Now, uh, this virus, you get infected with the virus. Then there's usually a 4 to 5 day honeymoon period where it sort of sits, usually in the back of your throat in the upper respiratory tract, can cause a little bit of burning there and whatever, maybe going to give you a little bit of a dry cough after about the fourth or fifth day. But that virus is going to very quickly start creating irreparable damage and fibrosis in your lungs. From what I have seen and the clinical evidence that we've been getting, and also all the work that's been done, because we're trying to understand how this virus is working, is that by the time you get to 2.5, 3 weeks into your incubation period, you've actually caused irreparable damage in most of your lungs. And that's when everything gets much worse.
And I'm assuming that's a small percentage of people, not everyone.
No, not everybody. It's a small percentage of people, but
And
ultimately, this is why they're getting up. They're getting worried because there's not enough ventilators in the world. Because you will end up with respiratory distress and you're unable to breathe, and as a result of that, you end up having death.
yeah, so my little brother, who's a hospitalist and internal medicine doc in Baton Rouge, he just told me of a young guy. I may get the age wrong, but it was 42 or something like that. Here we got his text message right here. Yeah, 42-year-old with high blood pressure. That's his only comorbidity, and he came in with an undetectable oxygen saturation, meaning they didn't have any, and they had to
Wow!
immediately
Wow!
intubate him.
Yeah,
And they're presuming it's COVID-19. The test is obviously still pending. Won't know for a couple of days, but this is a 42-year-old guy who's
yeah,
relatively healthy as far as they know. He wasn't exactly talking when he came in. So
yeah.
I do agree that this is happening to people. So since this can strike a lot of fear in people, as far as like, wow, this could mean I could be that 42-year-old showing up in the ER with already having death-like symptoms. How
Exactly.
can we get people to do a home test, or how can they assess themselves
So
before they call their doctor?
I thought about it, and I realized it was, it's simple. It's not a diagnostic tool, but it kind of works. Um, if you have already started, the virus has entered your system, and it's already started to actually attack your lung tissue, which it does within that asymptomatic time when you're 2 week period, you're going to find that your respiratory function, your lung function becomes compromised. So normal people, asthmatic smokers are probably going to be able to do it for less period of time, but normal people can hold their breath for longer than 20, 30 seconds. When your lungs start becoming fibrosed, that becomes severely compromised, such that patients who have got acute COVID-19 can only hold their breath for maybe 2 or 3 seconds. So I suggested to my patients that, look, you know, if you can do this every single day, then you're still, you're in the winning game. So if you can hold your breath, then at least you know that you've still got good respiratory function. So again, maintain all your habits of boosting your immunity, trying to avoid anything that could depress your immunity or your energy levels, or could put you in danger, including going outside.
Agreed. Agreed. So
You
the
know,
simple.
people
Go
just
ahead.
simple things. This is, I mean, that I think, I think ultimately the message is, um, try and stay away from people and wash your hands that way, and then don't touch your face. So try not to catch it and try not to give it to somebody, because it's not like you're sniffling and you're sneezing and you're blowing your nose and you're coughing and you're, obviously ill, and people who would look at you as in, should you really be at work, should you really be, in this restaurant, you look ill, and the thing is that they are not ill, they do not feel ill, they might have a little bit of a sore throat, and that's after 4 or 5 days, but they're not ill, but they're also highly contagious.
Right. So this simple exercise of holding your breath, what Dr. Joshi and I are working on, we're actually working on a spreadsheet to put together for you to start tracking your own vital signs and your own breath holding time.
Yes.
So we're encouraging people to get a baseline breath hold right now. Just simply, doesn't take any tools. Hold your breath as long as you can and see how long you can and write it down. What we're going to do is once the spreadsheet is done, I've still got some more work to do on it, but when the spreadsheet is done, you'll be able to record the date that you did it and how long you were able to hold your breath, as well as your temperature, your heart rate, your respiratory rate, and your blood pressure. And basically, all these vital signs, we'll call them, are used to see how you're doing as far as your symptoms or your system is going. So maybe you can hold your breath for the same amount of time, but your heart rate is starting to tick up without any different, you're not running, you're not walking, but your heart rate's starting to go up, or your respiratory rate's starting to go up, or your blood pressure's starting to go down. These are all the things we're going to look at as a physician, and these are all the things that you can look at as a patient to see if you need to go to the doctor, if you need to go to the hospital. These are early warning signs. And then you can use this spreadsheet, if you're tracking, you can use the spreadsheet to share it with your physician or nurse practitioner, or whatever it may be, your healthcare practitioner, so that they can see your trends over time, because everyone has their own normal. So someone may normally run a blood pressure of 100/60, but they may be going, what am I trying to say? If their blood pressure is already on the low side, we may be concerned, but if that's already their normal, then it's not really that concerning. Same thing with the respiratory rate, if it's going up, temperature's going up, whatnot. So once the spreadsheet is done, I'm going to be putting it on our website. If you want to sign up to get the spreadsheet once it's done, hopefully it'll be done tonight. Just go to my website, oobmedical.com/COVID19, and it's all over. I'll put it in the description and stuff. So, and then I'm sure Dr. Joshi will put it on his website. And so, real quick,
Absolutely.
Dr. Joshi, how can people access you? What are the ways?
Our Instagram handle is Joshi Clinic, and our website is joshiclinic.com. One of the other things I mentioned to you as well, Philip, today, because it was quite funny, we're having this conversation. So, we actually got into this, just by chance, because I think I made a comment and then you sort of said hello and whatever. And then I suggested this to you and thought, well, what do you think of this? I think people do want to be able to try and take a little bit more control of their well-being. What can we do to help ourselves? What can we do to, ensure a positive outcome? I think, if you've got a very good immune system, if you're strong, if you're healthy, your immune system is incredibly sophisticated and can deal with anything. It doesn't have the immunity yet because this is brand new, but it will slowly work it out. What you need to do is to allow your immune system the time it needs to respond to this virus. So if as you were saying, you check all your body functions. If your temperature is going up, don't panic. Because as your temperature starts to rise, that is showing that your immune system is actually kicking in. And what it's trying to do is to create a hostile environment where this virus is not going to be able to function and replicate. And again, another thing I put a few days ago as well is that the virus RNA, DNA has to get into your cells, and your cells are made up of a double fatty layer. Now, if you are somebody who's been doing very low-fat diets and dieting, or and you've been trying to cut back on your calories, etc., you may find that your cells are not as strong as they could be, and so this is not a good time for you to be doing a low-fat diet when you are sick. I think one of the things that in New York, one of my girlfriends would try and bring around was chicken soup. And so, what you want to do is to give the body the vital nutrients it needs with which it can defend itself and repair. So, don't let and I've been telling all my patients, have very hot baths, sweat it out. And if you feel like you could be coming down with something, don't worry, just sweat it out. Sing, do lung exercises, go for a little jog.
Singing, I like that.
Yeah, just do things to keep your lung function up, to also keep your lungs clear. So if we are in flu season, and it is cold outside, and people do get a little bit congested in their lungs. So to keep your lungs clear, I even suggested to you today to maybe make a tea with ginger and turmeric. The ginger, very warming for your tissues. It's an Ayurvedic cure. And turmeric, as we all know, everybody's having curcumin everywhere, is anti-inflammatory, but also acts as an expectorant. So if you find that you tend to get like a sort of a phlegmy chest, you get a little bit bronchial, I always suggest this to patients to put a teaspoon of grated ginger and a teaspoon of turmeric powder into a teacup and pour hot water, let the ginger infuse, put a teaspoon of honey just to give it a little bit of sweetness, and drink this. It'll warm you. It'll also help you cough it out.
And that's what
How
they're
was it
showing,
in
right? So any
Jaffa?
kind of steam or any kind of moist things keep the fluids going, and that keeps the lung tissue or the lung mucus broken up and thin, right?
Absolutely. All our listeners, know about how this virus gets into your body, and so one of the other things that's very important as well, and one of the professors in Hong Kong, one of the major universities there as well, also suggested that to protect yourself and to help yourself and to also reduce the effect of this virus on your body, keep drinking plenty of hot fluids because it likes a cooler body temperature. Plenty of hot fluids. Keep your throat as well very warm, because this virus will first sit in the upper respiratory tract and it starts creating like a little bit of a mucousy gel to begin with, which then becomes much more sticky afterwards. The more you keep your throat warm and your body warm and you're having lots of hot fluids, the less likely it is to become much thicker and gluier and therefore more of a problem. And you are therefore able to expectorate it. So, do these little things that are just going to encourage help your body's immune system and your body's natural defenses to kick in.
Agreed. You earlier when we were talking, you mentioned the menthol and eucalyptus oil.
Yeah, exactly. So again, doing steaming, going even into a steam room or a sauna or whatever, inhaling menthol and eucalyptus. Although with this, you
Now, when you
don't get a
say sauna, do you mean
congestion.
wet sauna or dry sauna or both?
I think both, but whatever is going to get your body temperature up. But I think ultimately with this virus there is no nasal congestion or bunged up feeling. But again, what we're trying to do is just to make sure that the throat, where this virus will initially start its work, you are creating a hostile environment, and therefore it can't replicate and it will die. And so
Right.
your body has actually fought it, which it's very capable of doing if you just give it the right support.
Now, you mentioned steaming, so maybe I'm a little naive. What do you mean by steaming? Like, how would someone do this? Is it just like jumping in a hot shower, you mean, or there's some sort of device that
Okay.
steams?
So if you have nasal congestion, and you have a sort of common cold or flu or whatever, what I suggest to some people as a sort of home kit is to get a pan of hot water, boiling water, and in that add a few drops of menthol or eucalyptus oil or both, and then put your face over the pan. So that the steam is coming in onto your face, and cover your head in a towel. So it creates a little bit of a seal, and you'll create like a little steam chamber where you're going to be inhaling these menthol and eucalyptus vapors.
Okay,
Yeah, it's
interesting.
it's a very similar thing like that is also used for children in their bedrooms, just to make sure that they're breathing more effectively at night when they're sleeping.
Yeah, and so that's more of a cool mist, and so people can add that menthol and eucalyptus to that
Yeah,
and breathe
yeah.
that into.
Exactly,
Okay, very cool.
and also warming up the lung tissue, warming up the airways, warming up the air that you're breathing in is going to loosen things within your lung tissue and allow you to be able to expel it, and therefore encourage your lung to heal and not become damaged.
Okay. Earlier you mentioned a really good point too, and this personally affects me. But you said to avoid dairy because dairy is mucus forming, and it
Yeah.
definitely affects me. Any dairy I have, that was what resolved my nasal congestion and allergic rhinitis that I had for 3 years was removing dairy. So, anything else you want to say about dairy in general or this?
If we're looking at dairy, if we look at sort of food as a in general rather than just dairy itself, your immune system is incredibly sophisticated and also incredibly complicated. If you notice that when you eat a particular food, your body reacts in a way, you may get a little bit of a headache, you may get a little bit of a shortness of breath. If you're having a little slight anaphylaxis, you may end up with a bit of a rash, you may end up with bloating, or you may end up feeling just a bit more tired or whatever. This is the body's immune system reacting to a leaky gut condition or something that you've taken into your body, which is causing an immune reaction, a cell-mediated response. Now, the other thing as well, just before I forget to mention, is that I'm telling all my patients not to have cold drinks, avoid ice, and to make sure that everything you drink and
This
eat
is
is
room temperature, just
above, above a room temperature or above. And then, again, so if you know that certain things give you an adverse reaction, you're very able to then start introducing good things into your diet that are going to give you a positive reaction. Squeezing the half a lemon, the juice into a glass of hot water in the morning and drinking that is going to give you bioavailable vitamin C. Taking your supplements on a regular basis, and also just trying to pay attention to the way your body reacts to its environment. It may not like the dry condition, it may not like the air conditioning, it may not like the heating. So whatever the body is telling you, learn with that, and we quite often just ignore it.
Yeah, that's so true. I always feel like I get a better breath even when I just step outside. There's something about recycled air, right?
Yes, God, yeah, yeah.
Well, so there's another thing we use in the U.S. commonly for cystic fibrosis patients, and I thought this was a great idea for anyone that wants to know what can I do to improve pulmonary fibrosis. Cystic fibrosis patients, although it's a totally different pathology, they have to do a lot of the same tips to keep their mucus from accumulating and building up. So I thought maybe we should be recommending some of the same things we do for cystic fibrosis. One of those things being Mucomist is the brand name here in America, or N-acetylcysteine. They'll do a nebulizer of N-acetylcysteine. Now that's hard to find, and I don't know anyone really doing that. But we've also recommended NAC being taken orally, N-acetylcysteine, it's a precursor to glutathione, as doing the same thing as breaking up that mucus tissue. Is that something y'all have used, or have you heard of that?
Yeah, these are all things that we use, but also, being Indian and also seeing how children are treated in villages in India, and also even my work in Russia as well, just seeing some of the sort of their medicine and their medical cures as well. In Eastern Europe, they believe that using warming oils on the chest, doing percussion techniques, everything to try and loosen the lungs, warm it up, loosen the lungs, get them breathing, is again going to help. So there are all these things that you need to do to give it a much more comprehensive and all-round approach.
Okay. And what about glutathione? Are y'all doing nebulized glutathione, or have you heard of glutathione for breaking up mucus tissue?
I use glutathione quite regularly in intravenous therapy. I must admit, I don't have any cystic fibrosis patients at the moment.
Me neither.
Thank goodness. And I understand that some doctors are using it, but it's not one of my protocols.
Okay. And then, so the last thing I thought of with the cystic fibrosis patients is that we would frequently use those chest percussion vests. Have you ever heard of those or
Yes,
seen those?
perfect, lovely, yeah.
So you may not have access to a chest percussion vest. It's just a fancy way of, but all you need to do if you have a partner or someone that's with you, or a family member, a loved
Yeah,
one, whatnot, and
yeah,
you have lung mucus built up, you just got to pound them. It's literally beating them up, hit them with your fist, and you want to shake those lungs and just kind of stir that mucus up. And what it does is it breaks it up, it thins it up, just like if you had a big thing of ice and you're trying to break it up, you got to shake it up and break it up in order to get that mucus out of the lungs. Because the lungs have these cartaginer cells with flagella or cilia that whip the fluid, the lung mucus up towards the throat so you can cough it out. But once it's too thick, that stuff can't work. So if you can break it up in any way, you can finally get that patient or that loved one to cough it up. One of the other misconceptions is if someone's coughing, 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 not bringing anything up, one of the things they need to do is they need to get air under the mucus in order to cough it out. You can cough, but if you can't get that air under it when you cough, it's not going to push anything because the air is pushing from up above. So you've got to break up that tissue enough to get that it opened up just ever so slightly, get some air in, so that they can finally cough it up. So you might have to use all these tips and tricks to get it. But chances are, if you're struggling this much to breathe, if there's that much mucus, you definitely need to be doing the breath holding techniques. You definitely need to be measuring your oxygen saturation if you have a pulse oximeter. And then there's a good time to start calling your physician or go to the ER. We're really trying to urge people not to go to the ER, not to go to the hospital unless you are ill. But there's this balance of waiting too long, and we really don't know how to guide people right now because it's too early. Dr. Joshi said in the beginning that this pulmonary fibrosis can kick in within 2 weeks and be rather asymptomatic, meaning not many symptoms until that kicks in. And that's kind of a scary fact. So.
The symptom you will have is that you will find that with this particular test, if you like, you'll find that you're not able to hold your breath for as long. And so it is gradually being compromised. But you will not have that acute shortness of breath, that difficulty in breathing, the pain in the chest that we are expecting patients to get if they have the virus after the incubation period.
Yeah. Well, I kind of ran. Go ahead, Josh.
It's gradually eating away at you, and you don't even know, and it's inside of you, and you don't even know. And so that's why I'm saying to people, look, this could be a very good way for you to just monitor on a regular basis. It's been I've been in isolation now for 8 days, 10 days, 12 days, and I can still do everything. I don't have any other symptoms, maybe a little bit of sore throat, but then that could be whatever. But it may necessarily be this. So these sort of things just give you a certain amount of reassurance that I'm not deteriorating, I'm not becoming ill, and I'm not going to end up as a statistic. And the other thing as well to mention, Philip, I think is very important as well, is your own mental sense of well-being while you are undergoing this, because there's a lot of fear in people at the moment, and they think that everybody is going to die or whatever. It is worse, this virus, than other viruses, but we're going to survive.
Yeah. So is there anything else you want to close with? I've got a couple more questions for you. Any other words of advice?
No, just, start taking care of yourself now. We've got this in our community. Don't wait till you think you've got it. Start doing it now. So just avoid the sodas, avoid the sugars, avoid the dairy, start eating more vegetables. Give your body the right nutrients it needs to be able to have a very healthy, vibrant immune system. Start taking zinc in your diet. The zinc will actually inhibit the virus from replicating. Vitamin D has been found clinically to stop the lungs from being damaged. So take a high dose vitamin D. Make sure if you are taking an oral vitamin D, you're actually having it with some fat. If you're having a fat-free diet, you may have difficulty absorbing the vitamin D. So I always suggest that patients take their vitamin D maybe with food where there may be some butter or cheese or cream or even meat or fish.
Mm-hmm. Okay. Well, so Dr. Joshi, say it one more time. How can patients contact you? Website, Instagram, whatnot?
JoshiClinic.com is our website, and our Instagram is Joshi Clinic.
And that's Joshi. I think you can see his name on the screen, but it's Joshi is Dr. Joshi. And so, are you doing COVID-19 testing, and are you seeing COVID-19 patients?
This is the other thing as well, is that a lot of places are running out of COVID-19 tests, and so we are doing them on some of our patients, but we're not doing them on every patient, because we again want to be able to understand what is going on. My mother called me this evening and told me that she's had a temperature for 2 days. You can imagine how I felt. And I sort of did a little bit more questioning. She went to one of my colleagues who's a general practitioner, and she saw him as well. And I said, so what are your symptoms? And she said, I've been sneezing, and I've got a sniffle, and my nose is completely blocked, and I've got a little bit of a headache and whatever. And I said, did he give you an antibiotic? And she said, yes. And I said, okay, I don't think you've got it, Mum, but let's just take it easy, and let's get you give an intravenous drip tomorrow.
Good. Well, best of luck to your mom. Hopefully she makes a full recovery.
Thank you.
Are you taking new patients right now, Dr. Joshi?
We are taking new patients. I work between London, Dubai, and Moscow.
Oh, wow. So, that's a lot of territory.
Always on the plane.
Okay, even now, are you doing telemedicine, I assume, right now?
Sorry.
Are you doing telemedicine, doing online consults, or are you going in person to these places still?
I know I go personally to these places, but I do a lot of online consultations as well, where I can give people advice on what they can do, or also what they can ask their own practitioner and healthcare provider to look at, and how they can work with this as well. Because a lot of my patients buy my supplements, buy my programs, and also start making certain changes they can themselves towards a better health.
Mhm. Okay. But before I let you go, let me see if there's anything else online that anyone's left a question. I don't see many questions, but it doesn't look like it's showing me everything. So I guess I'll just have to run with that.
Yeah,
All right, Dr. Joshi. Well, I certainly appreciate your time. We'll keep working on that spreadsheet. I'll put his information out online for people to see in Europe who want to get in touch with him, or clearly he's going to other countries. So if you want to contact him to become a patient, get tested, whatnot, and you'll be seeing more of Dr. Joshi because he's going to be my leading expert on pulmonary fibrosis, and hopefully none of you get it. But now you know.
lovely. Thank you. Thank you very much for your time, Philip. It's a pleasure as always.
Likewise. Bye, Dr. Joshi. Take care of
Thank
yourself.
you. Bye bye. Thank you. Bye bye.
Bye.